So in this segment, we're going to go through some basic exercises that you can do in the bed following a total knee replacement from the first day or day of surgery onwards. So Heather, we're going to go through some exercises for your right knee to firstly get it straightening and to also get it bending, okay, and start to work on some strength. We always emphasise trying to bend your knee as much as you can after a total knee replacement, but it's equally as important that you can fully straighten it too. The muscles at the back of the knee can get quite tight after surgery, so it's important that we start stretching them from the first day onwards. Okay? So just have your arms nice and relaxed by your side so you're comfortable. So the first exercise we're going to go through is just some basic breathing. Okay? So I want you to take a deep breath in through your nose as deep as you can, and then out through your mouth. So really important after having an anaesthetic that you do get your lungs to fully inflate. So you can do this in the bed, but it's more effective if you're doing it sitting out in the chair or with the bed head raised as well. Lovely. So once you've got the breathing down pat, we'll move on to the knee. So the first exercise we're going to go through is called static quads, which is just getting your knee straightening as much as you can. Okay, so you can straighten that leg out as well. What I'm going to get you to do is push your knee down into the mattress as firmly as you can. So you're activating the muscle on the front of your thigh. You should sort of feel the feeling of you squeezing your kneecap when you're doing that exercise. Good. A good way for somebody to test is that if you put your hand underneath your knee, you should feel your knee pushing down into the hand. Lovely. Now you can do this on both sides at the same time, and it's more effective if you bring your feet towards you as well and push down as firmly as you can. If you do get a sore back when you're doing this exercise, you can bend up your good side, just offload your back a little bit. Okay. Now, next exercise is circulation exercise, just for the calf muscles down the lower leg. So just pumping the feet up and down. Perfect. You can do that as many times as you can, at least 10 times on both sides. Now the next exercise we're going to go through is a small knee bending exercise in the bed. It's really good that you bend your knee as much as you can when you're in bed as well, so that it doesn't get stiff. Your knee will get stiff after about half an hour of not doing anything, so I would recommend trying to do small amounts of exercise as frequently as you can. So what I'm going to get you to do is slide your heel towards your bottom, so you're slowly bending your knee. So you go as far as you can to the point where you feel the stretch through the front of your knee, and then slowly slide your heel back down. Now you can also utilise a strap or a bandage around your foot, so you're using your two hands to help bring your leg up as well. Lovely. And as you are, make sure that you remember to breathe when you're doing these exercises. It's very normal to try and hold your breath when you're doing them, but it actually makes it harder. So try and always breathe out when you're bending the knee. Now the final exercise I want to go through is a stretch for the hamstring muscles, so the back of your knee. So you can use a pillow or a towel rolled up, something underneath your heel. I'm going to bring this on there. So you're going to rest your leg there. So you should feel this stretching down the back of your knee. Now I recommend leaving this there for 10 minutes. So it's a good one to do at the end of your exercises. And resting it there, you can have an ice pack on your knee at the same time as well and feel that stretch. If 10 minutes is too much to start off with, you can start with 5 and build it up, but try and work towards holding it there for 10 minutes. Okay, and you're just resting, feeling that stretch. Now there's one more exercise that you can do if you can manage it, which is utilising the pillow or a rolled up towel underneath your knee. So you can have your knees bent over the pillow or the towel. That's right, you can have your other leg on there as well if you want. So this is called inner range quads. So again, we're getting the muscle in front of your thigh working. It's slightly harder than just pushing your knee down into the bed. So what I'm going to get you to do is squeeze that muscle there, so you're squeezing your kneecap, and you're going to lift your heel up off the bed and straighten your knee as much as you can. Good. You can hold it for a couple of seconds if you can manage, and then slowly lower back down. And you want to make sure that the movement on the way down is controlled and you don't just drop your foot. Lovely. And again, slowly coming up. Straighten as much as you can, and then coming down.